Welcome to the How to Support a Loved One Who is Living with Chronic Pain webinar. I'm glad you're here today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is co-sponsored by CIRPD and Pain BC in collaboration with the Canadian Pain Coalition. It is also made possible through the support of the Direct Access Program through the BC government. As mentioned, my name is Tanya, and I'll be moderating the webinar and handling the Q&A session today. And our presenter is Susan Holtzman. Susan Holtzman is an associate professor of psychology at the University of British Columbia, the Okanagan campus, and she's a registered psychologist. Dr. Holtzman's research investigates the role of psychosocial factors in adjusting to chronic illness with a focus on chronic pain. She is particularly interested in how social relationships can help or hinder people's efforts to cope with their illness and how chronic illness can impact the family. I'm going to go ahead and hand it over to you, Susan.
Thank you so much, Tanya, and thanks everyone for joining. I'm excited to be able to share some information on this topic to everyone this morning or this afternoon, wherever you may be. I've been doing research on this topic for about 15 years now, and what I'd like to do today is to just start off by talking about where the research is at in terms of how social relationships can impact people with chronic pain. After that, I'll spend some time with more specific discussions around how to best support someone who has chronic pain. Some of you out there may be a support person, or you may be the individual with pain themselves. So hopefully this information will be useful from both perspectives. I also want to spend some time talking about what maybe might be good to avoid when trying to support someone with chronic pain. I think most of us are well-intentioned when we're trying to support others, but sometimes, despite our best attempts, some of our attempts may backfire. So I want to talk about some things to sort of watch out for if you are a support person. And we'll wrap up by talking about some ways that pain can impact support providers and how support providers can themselves support, their own well-being. So before I dive in, many of you may have seen this model before. I'll just start off by presenting it, since this is really the main model that I've used in my research, and it's the most widely used measure or model when we're trying to understand people's well-being in the context of pain. So obviously your pain is going to be affected by whatever disease or injury you have. Medication, genetics, all of those things come under the biological factors. But there's also that important role that we now know of psychological factors, your emotions and thoughts about your pain, and also the social context in which pain occurs. So the ways in which, for example, people respond to you when you're in pain. Do people trust you and believe you when you say you're having pain, even though you look just fine? So we're spending today focusing on the social aspects, but as you can see, these are all very much intertwined, and some of these other components will come up again today as we go. And if you aren't convinced already, I'd like to just start off by telling you about where the research is at in terms of social relationships and health. And humans really are social creatures, and relationships make a big difference in not only our happiness, which is probably less surprising, but also in our physical health. And the research on social relationships in general, so not just chronic pain, but social relationships in general, really got triggered by a really interesting sort of groundbreaking study that was done back in the late 70s. It's called the Alameda County study because it was conducted in Northern California in a county called Alameda, where they recruited almost 7,000 older adults, and they followed them over about 9 years to look at risk factors for mortality. And what they found was that the older adults who had a lack of social ties, so few friends or family, having a lack of social ties was actually equivalent to cigarette smoking and obesity as a risk for morbidity, so any type of disease, and death from any cause. So it wasn't just that these individuals were more likely to die from a heart attack, it was across all causes. And ever since this study was published, there's been just sort of an onslaught of studies that have come out to try to replicate this, and so many so that there was a meta-analysis that was published just a couple years ago that took almost 150 studies, over 300,000 participants who are trying to address the same question. And they again confirmed that there was a significantly greater likelihood of survival for those with stronger social relationships. So whether you're someone with pain or not, social relationships matter for our health. There's no doubt about it. What I want to stress, though, and what the focus of today's talk is not about the quantity of support you have. It's not about how many friends you have on Facebook or how many people call you every day. It does seem to be that the quality of relationships matters much more. So today we're not going to talk about how to provide more support. We're going to focus more on the quality and the types of support that might be most effective. And this is all something that we have control over. And if you yourself out there don't feel satisfied with your support currently, this is something that you can do something about through reaching out to others, cultivating existing relationships. In terms of the research on people specifically that have chronic pain, the results are quite consistent. So we know that if people that have pain are happy and satisfied with the support that they have, we find that they have lower pain intensity, they tend to report lower disability related to their pain condition, they're less depressed, less anxious, they seem to cope better, and generally just have a better quality of life. So this sounds pretty magical, and I guess the question starts to arise, well, how is this all happening? How is support having such a powerful effect? If we take a really basic look at pain and well-being, of course we know that if you have a pain condition, that's going to affect your emotional and physical well-being. But not everybody that has migraines or that has rheumatoid arthritis has the same level of well-being. Part of that is due to medical factors, but there's also a lot of action that's going on between sort of these two pieces here. And to help understand why different stressful situations can have such a different effect on people, exams is one example. You know, some people love exams, some people, you know, they can't sleep all night before. Races, some people are so excited to do a race, others just dread them. Same situation, completely different outcome. The transactional model of stress and coping was put forth actually by my old graduate supervisor, worked on this model quite a number of years ago, and it's still used today to understand why the same situation in one person can have such a different effect across people. And the reason I'm presenting this to you is because we can really understand how to support people with pain if we understand this whole stress and coping process that we're all going through. So in the context of pain, yes, there's that immediate emotion around pain, but there's also thoughts that go along with it. Is it, this is overwhelming, how am I going to be able to go to work today, how will I care for my children? Or is it, you know what, I think I can deal with this. I have a good doctor, I have a good support system, I can face this head on. And of course, depending on how you interpret that situation, that's going to affect how you cope as well. Are you going to withdraw or are you going to get out there and take action towards better well-being? So I'm going to follow this model for the next few slides and just show how social relationships can actually affect different parts of this process in someone with pain, and also along the way provide some tips for what may or may not work best. So if we put social relationships in the picture here, it turns out that, like I mentioned earlier, people with better social relationships tend to be happier and healthier. And it turns out that a lot of this comes from purely this perceived availability of support versus the support we actually get. So what do I mean by that? Well, perceived availability of support is basically the belief that you have support if you need it. So it doesn't have anything to do with what you actually get. It's basically knowing that people have your back. If you have a bad day, you have someone to call on. And this in itself is very strongly related to emotional and physical health. And this is actually good news in a sense if you're a support provider or a patient, because if you have that sense already, you've kind of already done a large part of the work already. If your loved one already has that sense that you're there for them if they need you, that's huge in terms of supporting their well-being. So every once in a while, just reminding that person that you're there for them if they need anything, just that statement in itself, knowing that, can really make a big difference. So that's one big part of the puzzle. But of course, the people in our lives also can really influence how we see the world, how we interpret our situation. And in the context of chronic pain, I want to talk about two different kind of opposite ways of thinking about or interpreting pain that seem to have a big influence on well-being, and what you might do as a support provider to sort of encourage the more adaptive ways of thinking about pain. And those two ways of interpretation are pain catastrophizing and pain acceptance. I actually did my PhD dissertation on catastrophizing, and it took me a long time to convince my parents that catastrophizing is a real word. And it is a real word. I think pain researchers have contributed to that a lot. And if you've never heard of it before, basically it's this sort of general negative mental set or set of ways of thinking about actual or anticipated pain. And these ways of thinking about pain are very negative and somewhat exaggerated. So feeling completely overwhelmed by pain, constantly worrying that it's going to get worse, feeling like you can't handle it anymore, and on, that's catastrophizing. We know for a fact that this way of thinking about pain and situations in general is associated with poor mental and physical health. At the other end of the spectrum is pain acceptance. This construct, even though it came about quite a number of years ago, has really gained a lot of popularity lately with research coming out about meditation and yoga and how that can help people cope with pain. Pain acceptance really is giving up that struggle with pain, giving up that perhaps hope that one day pain will be a 0 out of 10. Accepting that there may be pain to some degree in your life and living your life despite that pain. So it doesn't have to mean being happy you have pain. It just means that you are going to continue life despite it. So I'd like you to think about these two ways of thinking about pain as kind of flags, white flags and red flags, in a sense, that you might look out for in someone that has pain. And if you can, do your best to encourage acceptance. So talking to your loved one about, okay, it's true, it's a bad day, but what can you still do despite being in pain? Positive reappraisal, helping that person sort of see some more positive things about their day or about their current situation. So encouraging pain acceptance while trying not to reinforce that catastrophizing. There's some research to suggest that catastrophizing can sometimes, not always, but sometimes be used as a way to elicit support from people. You know, if you start saying how upset you are and how worried you are, if you have a supportive loved one, their response might be to rush over and try to talk you down and comfort you and provide support. But over time, that could actually, you know, the patient could be stuck in that cycle of catastrophizing and then along with it sort of pull their support person in, where it's this constant cycle of catastrophizing and reassurance where you're not really getting anywhere. Okay, so again, just sort of one example of how support can affect interpretation of pain. We also know that the way people cope with pain is also a huge predictor of well-being. It can't cure pain, but it can certainly make living with it much more tolerable. And we know that there are certain types of coping strategies that are better and less effective. Passive coping, generally not as effective, avoiding activities, social situations, worry, denial, self-blame, all of those things really avoid facing a situation head-on. Sometimes this is a good thing, and it's okay if you worry, and it's okay if you take a day or two to just sort of be antisocial. Absolutely. I'm talking more about a sort of an ongoing pattern. Active coping, on the other hand, is taking steps towards improving your situation, whether it's seeking support, information, doing your relaxation exercises, and so on. And there are ways that, as a support person, you can encourage the active side of coping and discourage the passive. And it is not nagging, although we can be tempted to do that. There are ways to encourage active coping that can actually be perhaps more well received. And that can be through things like being a role model. If you yourself are an active person, you take care of yourself, perhaps you meditate every morning, go for walks every morning, that sort of demonstrating to your loved one that you value those things, it's possible to incorporate them in your life, and maybe you can even do them together, you know, turn that into a team activity. Planning social and leisure activities, especially those that can be flexible. Sometimes there's a tendency not to want to schedule things because you don't know how you'll be feeling that day. But if you have friends and family that understand, then maybe those are the friends and family you want to spend more time with. Okay, so again, looking at this model, we can sort of start to understand why social relationships can have this big effect on well-being, because they can just generally give us that better sense of well-being and reduce stress, but they can also help us interpret our situation in a better way and cope more adaptively. So that's one way of sort of looking at how relationships can influence people with pain. I'll talk about another way of understanding social relationships and pain now, and that involves talking about more specific types of support. Research has sort of identified 3 basic categories of support: emotional, instrumental, or tangible support, and informational support. So for the next few minutes, I'm going to talk about what types of support tend to be better than others. And not all support is created equal. So emotional support is not the same as instrumental support, and even certain types of emotional support are not all the same. So I'm going to try to refine that a little bit. Emotional support, I think everyone probably already has an intuitive understanding of what that is. But basically, it's any type of support that you may give somebody that makes them feel loved and cared for, makes them feel like a worthwhile and validated individual. And when we've done studies to look at what is perceived as most helpful among people with pain, it turns out that emotional support is the top-rated preference for support. I did a study of about 70 people with rheumatoid arthritis, and we asked them about the types of support they got every day from their spouse and satisfaction with their spouse. And it turned out that support that made that person feel valued and accepted, loved, and cared for by far was associated with the highest level of satisfaction. So letting your loved one know these things, you don't have to say it every day. Maybe you want to, and that's great, but just letting them know in whatever way fits with your relationship that you care about them can really make a big difference, not only for their mood, but even for their levels of pain. Taking time to listen when they're having a bad day, and of course that goes both ways, the listening. Providing encouragement, we've already talked about some specific things that you might want to encourage, the active coping, the acceptance of pain, rather than stop always worrying, stop catastrophizing. Try to focus on reinforcing the positive as opposed to highlighting or punishing the negative ways of coping. And if you notice that your loved one has been doing really well lately, or they walked longer than they have in several months, you know, give them positive feedback and remind them about how they were several months ago and compare how they are now. And sometimes you don't need to say anything. Sometimes it's just a hug or a kiss. Any type of physical affection is also considered emotional support. This is probably not sounding like rocket science at the moment, but I do want to point out some little caveats here. Do what's natural. If you leave this webinar and you start sort of shifting your ways and it's not consistent with your personality or the nature of the relationship that you have with that person, it's probably not going to come across as authentic, even though you want it to mean it to be helpful. So do what's natural and what feels right for your relationship. Also, excuse me, support and encouragement is not the same as pity. I think probably the best way of explaining this is if you think about parents and their kids, and if you imagine a little kid playing at a playground and they're running around having a good time, and all of a sudden they fall and skin their knee. They look up towards their parents and they could do one of two things. One, which is what my mom would do, is, "Are you okay? Oh my goodness," and the eyes go wide, and oh, the pity and concern, and oh, the worry. What is that child going to do? Well, they'll probably start to cry and be concerned too. On the other hand, some parents will, you know, acknowledge the pain, but also, you know, provide support, like, "You're going to be okay," distract them and encourage them to keep doing what they were doing, obviously, as long as it was nothing serious. So concern is good, but over-concern and sort of pitying, putting that person on a different level than you, tends to be perceived as unhelpful. So again, be mindful of the way in which you express concern and support. And there can be too much of a good thing. Emotional support is definitely an effective thing to do, but if it's constant, again, going back to that pity and over concern, you don't have to ask your loved one how they're feeling every hour on the hour. And so being mindful of how often you're checking in and how often you're expressing concern can be something good just to check in with for yourself. So that's emotional support. The second category is instrumental support. Sometimes it's called tangible support. It's basically, you know, anything you could hold on to, something concrete, helping with household chores, giving somebody a lift to a doctor's appointment, providing money. And so in the case of chronic pain, there's always things that people can do and perhaps can't do. So identifying what your loved one can do is really important in terms of maintaining their own self-esteem and self-confidence and sense that they can do things on their own. And then once you've established what they're able to do, then you can sort of divide up tasks accordingly. Making a schedule ahead of time so everybody knows where everybody needs to be and who needs to do what can be really helpful. And related to dividing up tasks and doing things, it can be very tempting, and I'm sure this isn't the first time you've heard this, but it can be very tempting if somebody's having a good pain day to just try to get everything they've been wanting to do done in the past month done on that day because they're feeling so good. And then, of course, what happens is the next day it's just a big relapse where they're much worse off than they were even 2 months ago. So reminding your loved one as you're helping them to maintain a realistic schedule and set of goals. It can be tempting, though, to come in like Superman or Superwoman, especially if you're doing well and especially if you have time to do things for your loved one. It can be really tempting to just take over. And to sort of inadvertently reinforce avoidance and inactivity. With chronic pain, generally speaking, pain is no longer a sign that activity shouldn't be engaged in because sort of those messages have now sort of become a bit dysfunctional, and it's best usually to be active to whatever is appropriate for that individual. So being careful, again, this goes back to that pity, is providing too much support, because we actually know, and we've known for a long time, that providing too much physical assistance can actually worsen pain, disability, and depression over time in people. So again, resisting that urge to taking over, even though it can feel really good and at the time your loved one may be very grateful, in the long run, sometimes, again, this is all sort of in moderation, but in the long run that pattern can be maladaptive. Okay, informational support, the last category of support, is basically providing information or advice. This type of support is important in the context of chronic pain, but it's probably on the lower end in terms of what patients say is helpful and what they want from their loved ones. This is typically lower on the scale, not to say you shouldn't do it, but you can be helpful by reminding your loved one about strategies or approaches that have worked for them in the past in terms of what's been helpful to reduce their pain. And because there is so much to learn about pain, if you can and if you have the time, the more you're able to educate yourself about issues related to pain. The fact that you're online now is a great example of just arming yourself with information. And joining a support group is another source of information, but also emotional support. And even informational support has its caveats and its buts. So the ones that I will point out here, first of all, you don't have to have all the answers. And in fact, if you have all the answers, it'll probably be a little bit annoying to your loved one. So sometimes providing advice is, it's great if you've read up and you've got all these great suggestions and so on, but sometimes those reminders or that advice can be perceived as nagging, unfortunately. And sometimes where suggestions come from really matters, and sometimes suggestions from spouses or siblings or parents can, even though, again, they're well-intentioned, can come across in a less well-intended way. And so sometimes that support is better off coming from other people with pain, from doctors and so on. So just being mindful of whether you are providing information or advice that is being requested, that is desired, or perhaps it could be getting into a situation where this advice or information is not really desired or required. Okay. So again, that's sort of another way of thinking about support and what might work and what might not. And as much as I've tried to, and I'd love to give you a list of do this and everything will work out, of course it's not possible. And everybody's different, and everybody's personality and support needs are different. And the social support literature has really, really identified this as important. And in fact, the matching hypothesis was developed quite a long time ago in the social support world, that to be effective, the type of support needs to match the needs of the recipient and the situation. So there's such a diverse audience of you out there today that it really is impossible to give you some entirely specific suggestions about what to do. These are just guidelines, and you know, the match really does depend on the situation. This one may be a little more obvious, but emotional support, you know, is not going to help somebody get to the doctor's office. They need a ride. So whatever the support is, it needs to match the needs of the individual. I have a friend who, whenever she has relationship strife or stress in her life, her mother mails her a check. And she's trying to be helpful with these checks, and I'm sure on a certain level my friend is okay with getting money, but it's really not what she wants. She wants a listening ear. So just be aware that support's only going to be effective if it's matching up with the needs of that person. And so for that reason, have a conversation, have an open conversation. You don't need to know, you don't need to be a mind reader, and it's kind of impossible to do so. So have a conversation. What do you need as a support person, and what does your loved one need? You know, what do they really need you to do if they're having a bad pain day? Perhaps you can make sort of a game plan, a list of strategies that you can sort of go to on those bad days. And taking a step even further back, how do you even know when they're having a bad pain day? Some people are very expressive with their pain, and some people are pretty stoic about it. So, so having just an open conversation and identifying those red flags can be really useful. So there was a number of additional things I really wanted to talk about today, and one that I decided to sort of include here is the issue of mental health and when you might suspect there are mental health issues at play in people with chronic pain. The risk of having an anxiety or mood disorder if you have chronic pain is anywhere from 2.5 to 10 times more likely or higher in those with chronic pain compared to those who do not have chronic pain. So the issue of chronic pain does unfortunately go hand in hand with mental health issues. Substance use is another one that can often go hand in hand. So if you suspect that the inactivity and lack of motivation in your loved one is not just personality or not just because they've been having, you know, some bad pain days, if you suspect that there might be something going on in terms of depression or anxiety, this is something that needs attention, because people, when they have chronic pain with a mental health issue, we do see their sort of progression is typically, can typically be faster in terms of disease progression. Levels of disability tend to be higher. Pain can even be higher if you're depressed. People often report higher levels of pain if they're depressed. So I'll talk very briefly about depression because it's, we use the term depression or depressed kind of interchangeably to talk about people that are feeling a little down in the dumps one day versus people that actually have clinical depression. Clinical depression can be treated. It's technically referred to in our book of mental health issues as a major depressive episode or major depressive disorder. And this is a period of depression that lasts at least 2 weeks. There are at least 5 of 9 symptoms, 2 of which one of which needs to be either sadness or a lack of interest or enjoyment. Some people don't seem sad per se, but they just aren't really interested in anything that they used to be interested in. A lack of energy, changes in sleep and appetite, feelings of worthlessness, thoughts of suicide. Typically, even though we say at least 2 weeks, usually depression goes undiagnosed for much, much longer than that. And the key here is that one's life is interfered with. So either social life, employment, anything, basically major life tasks, if they aren't getting done, it could be depression. I won't go one by one, but I do have some resources that if you're interested, you could go back online when the presentation is posted on the website to jot these down. But there are lots of resources out there. There is a bright side. In Canada, we've got a number of associations that actually have screening tools online that you can go through and check off symptoms, and it'll let you know what the possibility is that there's some kind of mental health diagnosis there. And there are effective treatments, drug treatments, cognitive behavioral therapy, and mindfulness-based stress reduction have been shown to be effective. There's also a lot of self-help options out there. I've listed a few here. But if you don't have the time or the money, but you can go on Amazon.com and spend $30 or so on a book. And actually the Antidepressant Skills Workbook was developed in BC and it's free. These are really good options out there and can make a huge difference. So whether it's for you, your loved one, or somebody else, there are resources out there. And again, it's something that is really worth paying attention to. It can make the treatment of depression a lot more complicated. Okay. So speaking of mental health, I guess then the next question is, how are you doing? If you're a support person, how are you coping and holding up? I'm spending a bit less time on this piece today, and it's not because it's not just as important. I think there's probably just a bit more out there available online about being a caregiver, but less about specific suggestions and strategies to be a support person for someone with pain. So I just want to put that out there that my lower level of emphasis is not because it's less important. And actually, there's lots of benefits to being a support person. People often will say that their life satisfaction and their mental health is better. They're happier being able to be a support person. People often will say that their relationship is closer because of some kind of chronic illness that has drawn a couple together, for example. People can derive a lot of self-esteem out of being a support person as well. Of course, there's also just as much research, if not more, showing the costs of providing support. And if you are a support person, these may look familiar to you as well. There are higher rates of depression in caregivers. Relationships, as much as they can flourish, can also weaken and become full of conflict and so on. Something I didn't mention is that conflict and criticism in relationships has also been found to actually increase pain. I've done some research demonstrating that when you have interpersonal conflict with somebody, pain can actually go up as a result. So on one hand, support can improve pain outcomes, but when that's the relationship is negative and critical, that can have kind of an opposite effect. If you're devoting a lot of time as a caregiver, you may notice differences to your ability to work, decrease in financial resources, whether it's due to work or because of extra treatments that you're having to seek out, and social and leisure activities. So given this, I'm going to tell you some things that you probably already know, and that is to take care of yourself. It's easy to tell our children or siblings or basically anyone else but ourselves to take care of themselves, but it's a lot harder when that person is yourself. And I like to think about the sort of analogy I've heard before where if you're in an airplane and the cabin pressure drops and the masks fall down, they always say to parents, put on your own mask first before your child. And the same can be said with caregiving. If you're not well, if you don't have the internal resources yourself, how can you take care of anybody else? So get sleep, get exercise, maintain a healthy diet. And again, those are all things that you can do together with your loved one so you're both happier and healthier. Don't be afraid to take time for yourself. Be realistic in what you can offer. And be okay with seeking and accepting support for yourself, whether that's through friends, family, or some more formal support system. And so I will challenge you all today to make just a small goal, something that's very measurable, something very specific. Maybe it's just going out for a walk later this afternoon. Try to do something every day, if not most days, just something small that's going to make you happier and healthier. It's those little small steps that we take every day that add up over time. So I challenge you to think about what you might be able to do today or tomorrow to take some steps, some bigger steps towards self-care. Okay, so like I said, I haven't spent as much time on supporting the supporters, but I'll just provide a bit of a summary of what we talked about today. And again, I'm looking forward to hearing your questions as well. So basically, like I mentioned earlier, if you are a support person for somebody and that person feels like you're there for them if they need you and they can rely on you, a big part of your job really is already done. So hopefully that's reassuring to many of you that that piece is huge and what you do day to day matters, but I would argue that that bigger sense of support availability is even more important. Don't hesitate and don't be shy in bringing up a conversation about support and learning about what your loved one really needs and what they want. Emotional support generally tends to be most effective, and support that specifically encourages acceptance of pain, active coping, and again, providing support that is not pity, that is not that over-solicitous Superman or Superwoman support that's really well intended but can sometimes backfire. And those Supermen or Superwomen support providers can often be the ones that, in addition to not really being that helpful for the patient, end up burning out themselves. So please do be aware of any signs of burnout in yourself and take care of yourself first. And that's everything. So thank you so much for your attention, and please share your questions.
Very good. Thank you very much. There was one woman who had a question about, as a person with pain, she has a hard time getting her family to discuss her pain with her.
Okay.
She said specifically like that they tend to be fairly supportive, but not in direct discussion about, like a frank discussion about chronic pain and about her pain. because it makes them feel like they're inept or, not they don't fully understand it maybe. So she's wondering if there are any tips you have on that, like starting that kind of communication.
Yeah, I mean, I think that's a challenge, and asking for support can be difficult. I think, approaching it even from a more general sense about everybody's support needs and sort of a check-in with the whole family, like how's everybody doing, and as part of that conversation, her specific needs could come up, could be one strategy. Referring people to information about chronic pain. I mean, I think your institute has a lot of great information that perhaps sort of letting them learn on their own time could be more useful, or even having a physician explain things, or if you have a healthcare provider that can explain it for you in a way might be better received. But I wouldn't hesitate to express your needs, and sometimes it takes a few times to try that conversation. Sometimes people can be scared off by a couple of sort of ineffective conversations, but it's definitely worth something to keep pursuing, I would say, yeah.
All right, and then there's a couple people who are saying, asking for tips when, as the support person, you also have chronic pain, but you're also supporting another person either with pain or with another serious illness of some sort.
Absolutely, yeah, and that's probably, unfortunately, especially as we age, becomes more common than the other situation where one person's totally helpful, absolutely. I think planning is huge, so you of course can't always plan for bad days and good days, but if you sort of have a plan in place for how are you going to get things done if you're both down and out, what are the things that you can maybe recruit others. So if this is a sort of a marital relationship, perhaps there's other people that you could recruit in your support network to come in and help as well. Don't be afraid to sort of extend those arms out to get support from others as well.
All right, and then one support person was asking what to do when the person who you're supporting, the pain takes up most of their thoughts and energy, leaving little room for life, and what you can do maybe to help pull them out of that cycle or along those lines.
Yeah, no, that's a good question. That definitely, it sounds like that person might be someone who catastrophizes, or even somebody who is depressed. So I think the number one thing I would suggest is to maybe probe a little bit in terms of the other symptoms, educate yourself as a support provider on what the symptoms are of depression, because if it is depression, just sort of encouraging that person to get out and do things and chipper up is probably not going to work if it's actually clinical depression, and they might need medication or they might need actually one-on-one therapy. So I would consider that first. But there are small things. You can call them experiments. If there are things that person used to like to do, you can identify those and just try. You could almost even say, just humor me. This is something we used to like to do, or you used to like to do. Let's just go for an hour, half an hour, and do it and see how it goes. And usually that person will think it's going to be dreadful or unenjoyable. Odds are they're going to enjoy it a lot more than they thought, and it'll at least be better than sitting on the couch and worrying. So you can encourage those little bits of activation and build on those over time as well.
All right, and then We had another question. How, as a caregiver, do you deal with the sadness of seeing someone you love in chronic pain, that separation of emotion?
Mm-hmm. Yeah, that is a tough one, and I think there's lots of research to show that we're wired to empathize with people when we see the look of pain in someone's eyes, especially if it's a loved one. That can actually hurt us too. Taking care of yourself is huge there, and unfortunately I don't know if there's anything that can make that hurt go away, but if you can try to focus on the positive experiences that you have with that person, remind yourself as much as you'd like to make them okay, you can't, and you can just do your best in supporting them, and the fact that you're there and you care about them is a really big deal. And without you, I'm sure there would be a lot more pain. So the more you can, just try to be there while also just, I don't think you want to put up a bubble, but really try not to take that on yourself, because if you're starting to take that on, that's not going to be helpful for the other person.
Very good. And then what about any strategies for when the person you're supporting is becoming overly dependent on you and on your support?
Yeah, and that's kind of like what we were talking about with the dependence, and once that sort of dynamic gets set up, it can be a little bit more challenging to sort of get out of that, but it's definitely not impossible by any means. So if somebody's becoming a little overly dependent, I think sort of the same example with the experiments could be applied here. So even though somebody may enjoy having things done for them, on a certain level, I think that the satisfaction and reinforcement that you get for doing things on your own, that's still there. And so if you can, again, if you even just set up more of an agreement, doesn't have to be some formal contract, but talk about how things have been divided up and maybe gradually add a little bit back, just gradually a little bit back more back on that other person's plate. My guess is that as they sort of get more experiences doing things for themselves, it'll become reinforcing over time, but it may not happen immediately, so it may take a little bit of time. But I think you're on the right track to be noticing that, because it's true over time it's really not helping them, and you could even explain that in the moment this is helpful, but over time it's not sustainable.
All right, and then just a little bit, someone asked for the opposing situation, when someone is incredibly overly independent, like they're a very independent person, and they won't let you help or take your suggestions, even though they say that they want your suggestions. They're always saying no, and they're always wanting to do everything themselves, and they won't really let you support them in that manner.
Right. Okay. So then I guess the question is that okay for that person to be independent, or is there a cost for that person? So if they're fine, if they really are fine and able to do things, we like to help, but sometimes our help isn't needed. So that could be a situation. If it isn't, and it's to the point where that person's exhausting themselves and their pain is worse and their energy is lower, something that you could try, not sure if they'd be willing, but sometimes if people keep track of pain diaries, so what their pain and energy is like, and also the activities of the day, if you can sort of get that person to monitor what they're doing and what's contributing to their pain. I guess the key is, to find out what what's in it for that patient to accept more support. What's the buy-in for them? So if you can somehow identify what the buy-in or what the benefits to them would be, rather than trying to just convince them they should take support for the sake of taking support, maybe you can get somewhere that way.
Very good. And then we do have a few resources as far as pain diaries and pain function diaries. So I'll post links to those when I do the recording and everything.
Great.
And then one more question that I was given is from the pain supporters position, is there more information available on pain catastrophizing and how to help a loved one get out of that mindset?
Ooh, yes. Trying to think specifically catastrophizing. I know there's some research articles out there for sure on that, and then I can look for some literature. Is there a way for me to send you some more links after this, Tanya?
Absolutely, and I'll send you a follow-up email with just some of the things that were talked about as resources to grab them from you, so I'll just add that to my list.
Okay.
Okay. All right, then let me just do a quick check. I think that's all the questions. So thank you very much, Susan. That was a really great presentation. I'm excited that we were able to have this discussion with you today.
Thank you. Yeah, it was fun for me.